Dr. Cleary, can I ask you first of all about this respiratory diagnostic hub that you've set up? It's quite a novel approach and bringing, I suppose, solutions to the creaking health service.
That's right, Sarah. In Armagh and Dungannon Federation, we provide services to 23 practices. This respiratory diagnostics hub is providing advanced lung function tests to patients of the practices in Armagh and Dungannon Federation. It was born out of a need which arose during COVID. There was a certain amount of spirometry going on in practices prior to COVID, but because of the infection control concerns during COVID, that all had to stop. It meant that our practice nurses fell out of the way of doing spirometry. Some of those nurses retired during COVID. New nurses that came in didn't have the experience to carry it out, and there was then a dearth in the provision of this really important test, and people with suspected lung conditions like bronchitis and asthma were not being accurately diagnosed.
So what do you want to be done here? I mean, we have a new health minister in place. What do you want Mike Nesbitt to do?
Well, we as a federation have funded this ourselves as a pilot. We want to prove that it is successful to do advanced lung function tests in primary care. We want to show the benefit in getting a timely diagnosis for our patients, not just diagnosing chronic bronchitis and asthma, but maybe picking up more complicated lung function or lung problems. Those patients, we can then shorten their pathway to specialist care in the hospital. And we want to prove that if this can be done in primary care, we can get to more people quicker and shorten their pathway, and prove that this needs to be done regionally, and it should be a commissioned service across the region.
So what have you found with having the hub, and when you set it up, was it making a difference? Were people getting diagnosed sooner, and ultimately were you saving lives?
Well, the thing about respiratory conditions is that you have repeated attendances at your GP, and unfortunately you might end up in A&E more often if you're not on the correct medication. If we don't have the proper testing, we are making a good estimate or a good guess at what the patient's condition is and giving them an inhaler to treat it. But the spirometry and advanced lung function is the gold standard and will give us an accurate diagnosis. So putting people on the correct treatment from day one. And then if they have more complex problems, we're getting them to the right person at the right time.
If anybody's listening to this interview and they have any concerns about their breathing, about their lung function, what would you recommend?
Anybody who would have a persistent cough or is breathless, and this is a prolonged condition, not just from a recent viral infection, should be booking an appointment either with their practice nurse or with their GP. If that person has already been started on treatment, they should book a review, because if they have been one of these patients who has been treated the best we can without this test, it is now available to them at their GP surgery to have this test and improve their care.
Dr. Cleary, we'll leave it there. Thank you very much.
Thank you, Sarah.